The oxygen provided by home and portable concentrators can be dispensed in one of two ways, commonly referred to as either continuous flow or pulse dose delivery. Both of these provide medical-grade oxygen. However, the dosage is measured differently. Let's take a closer look at these two oxygen delivery methods to help you and your physician determine which is best suited for your lifestyle and oxygen needs. Continuous flow oxygen flows without interruption from the cannula and only stops when the concentrator is turned off. Continuous flow concentrators will deliver the same amount of oxygen through the cannula regardless of the patient's breathing patterns. This type of oxygen delivery allows the flow rate to be measured at a constant volume of LPM, or liters per minute. Pulse dose oxygen concentrators are engineered to dispense oxygen when the machine senses that you're breathing in. A pulse dose of oxygen, referred to as a bolus, is triggered and released when a patient inhales through the cannula. Pulse dose oxygen is measured in settings that indicate how much oxygen is dispensed each minute. It's indicated in milliliters per minute. The amount of oxygen received by the patient in a minute will vary with the manufacturer, the unit, the setting, and the patient's breathing rate. The size of the bolus of oxygen dispensed increases when the settings are increased. While a setting of 2 on a pulse dose machine approximates 2 LPM on a continuous flow machine, these are not the same. We recommend all patients considering a pulse dose machine both discuss the pros and cons with their doctor and test the unit to make sure it works for their specific needs. Each model of portable oxygen concentrator has a maximum oxygen output, or the maximum amount of oxygen a given machine can deliver. Similar to a car's horsepower, this is a good measure of a machine's capacity to provide medical-grade oxygen. Pulse dose delivery was originally designed to allow for smaller machines and longer battery life, so many smaller portable models only offer pulse dose settings. Some larger portable models now feature dual mode and offer both continuous flow and pulse dose delivery. On the other hand, home or stationary oxygen concentrators are larger and can accommodate a higher liter flow. These units are continuous flow only and are a great option for nighttime usage, and they're compatible with CPAP machines for sleep apnea. If you need oxygen therapy, your doctor will prescribe an oxygen flow rate such as 2 liters per minute, which means you'll need 2 liters of oxygen flowing into your nostrils over a period of 1 minute. Oxygen prescriptions generally run from 1 liter per minute to 10 liters per minute, though 70% of prescriptions are 2 liters or less. It's important to consult with your doctor regarding your specific oxygen requirements, both at rest and exertion. Determining the correct dose for both daytime and nighttime use will allow our oxygen specialist to assist you in selecting the right equipment when renting or purchasing your concentrator. We recommend you ask your doctor about using a pulse dose or a continuous flow machine and the recommended settings on each. If you're upgrading to a newer model, please check with your physician whether your oxygen requirements have changed. We highly suggest purchasing an oxygen concentrator that can deliver oxygen higher than prescribed to accommodate any changing needs. With the lowest online prices and same-day shipping, the Oxygen Concentrator Store is your source for pulse dose and continuous flow oxygen concentrators. If you have any questions, our oxygen experts are standing by ready to help. When you breathe easier, we breathe easier.